Hello and welcome to our podcast, The Doula and The Doc, hosted by Vanessa Salerno, a birth and postpartum doula.
As well as Dr. Joseph Scroy, an obstetrician, gynecologist and fertility specialist.
Together we'll be discussing a range of topics from preconception, pregnancy, birth and also the postpartum period.
Together we combine holistic insights and medical expertise. We dive into women's and men's health with honest information and sometimes the unexpected conversations.
This podcast is where evidence meets experience, so let's start the conversation. Please note the information provided in this podcast is for educational and entertainment purposes only and is not intended as a substitute for professional medical advice, diagnosis or treatment. Always seek the advice of a qualified healthcare professional regarding your own pregnancy, birth and health-related conditions.
This season of The Doula and The Doc is brought to you by Libra.
Welcome to the Libra Odd Spot.
Yes, if anyone knows when you are in the bathroom and you are taking out your pad, we have odd spots and we love to sit and read while we're in the bathroom.
So stop scrolling and start reading.
Okay is one of the most popular words.
Okay. Right. Cheetahs can't roar, they just purr and chirp.
Welcome back to the Doula and the Doc. And today we have Patrice Daglis, who's going to share her journey into parenthood.
Yes.
Yeah.
Yeah. And what a journey it was.
It was. So thank you for coming on and let's chat.
Yes.
And it's important to note that, obviously this podcast might be a little bit triggering because it does bring in a whole range of trauma that can happen during pregnancy, but not every pregnancy goes smoothly like it goes in the movies. And, sometimes people have a rough time in terms of their pregnancy and their birth journey. But let's start off with the positives. How old's your little kidlet at the moment?
So she's 4.
Yeah.
So she's well and truly out of that, toddler phase and, we're thriving and she's got all the personality to boot and, it's really good.
And what's her name?
Sophia.
Sophia. Awesome.
Yeah.
Any sort of funny stories about Sophia, something that she's done that's been funny?
Yeah. Oh, every day is funny with her. She's a character. So she's a little actress. So she can sing and dance and she likes to perform and, she's got like wild curly hair and she just came out looking the opposite of what we thought she was going to look like.
Really?
So she's her own little brand. That's what we say.
Cute.
Yeah.
Do you take lots of photos?
Yeah, too many.
Yeah.
I have to download iCloud storage.
We tried with our 6-year-old to do a photo a day. It's a little bit hard. It's getting more like a photo a week.
That's
now.
sweet.
But it's quite good because there's a nice chronology of, how she's changed from a little baby until now.
I love that. Is it always in the same position,
same
place? Like,
although I have seen something really cool where a dad interviewed his daughter every single first day of school from prep until year 12.
Yeah.
It's quite cool. Like, what are you excited about this year for school? And, eventually it changed over the period of those.
You've got a
13
photo of a year every year at Christmas.
Yeah, Christmas. My eldest daughter, who's now 19, and my youngest daughter at 6, we try to take the same sort of shot in front of the Christmas tree.
Oh, that's
with
sweet.
Kiara holding Isla and Isla kissing Kiara on the cheek, and I try to mimic it every year. We've got obviously 6 or 7 of them now, so that's pretty cool.
I've seen people reenact them then when they get older.
Yeah.
When they're in their like 40s.
When they're
they
all
do
in the
that.
Yeah.
All the cousins are in the bath.
I actually saw a photo of this young couple, these couples going to a Beatles concert back in whatever the 1960s or whatever, and they recreated the same photo that they did because apparently one of the Beatles, I think it was Ringo or someone, saw them in the car and so they recreated that photo.
Yeah.
All right, so some fun stuff, obviously, and you look back on your birth experience and your pregnancy, and it's such a sort of a massive part of a woman's life, particularly when there's a lot of expectation in terms of trying to conceive and having a baby, and it becomes such a focal point of your life. But things do evolve and change, and you start, I think you said before we started the podcast, that you try to pigeonhole stuff and put it away.
Yeah.
But tell us a little bit about, your journey to becoming pregnant. Had you guys tried for a long period of time, or was it sort of like, 1 month we got pregnant?
So I think for us, it wasn't necessarily the trying to get pregnant part that was harder. So I think for a lot of women out there and a lot of, men and women, they struggle to fall pregnant. And I think the focus is really on that fertility side of things. For me, it was more about before I fell pregnant, we'll call it the dramas, but I guess the trials and tribulations of my health that led me to the point where it was challenging for me once I fell pregnant. So I guess just rewinding, before I fell pregnant, I was diagnosed with something called cervical dysplasia, but in the severe form. So what that meant was it was picked up on a cervical test, on a pap smear, and I found out that I had high abnormality of my cells. And so it led me down a path. I'm not sure how much information you want about that, but it led me down a path where I had to have something called a cone biopsy. And part of my cervix was removed. So it was the struggle of not knowing whether I would hold a pregnancy once I fell pregnant.
So I might just explain that to
our listeners. That would be good, yeah.
So HPV is a very common virus. I mean, pretty much a lot of people have it. It's one of the reasons why early on in a girl's life, and now blokes as well, or kids, we vaccinate for the HPV virus. There's two different types. There's many different strains, rather, of the HPV virus. Some can cause genital warts. But there's two particular strains that can cause cervical dysplasia or precancerous cells of the cervix. And so part of doing this cervical screening test now, it used to be called the pap smear, but part of doing the cervical screening test is to pick up whether there's HPV within the cervix or within the vagina, so that we can determine those women who are at risk potentially of developing these precancerous cells. Now, of course, it's now done every 5 years. Your cervical screening test is really important that you get that done every 5 years, because what we're trying to pick up is precancerous cells even before they become precancerous cells, when you've just got HPV. So what happens with HPV is it's a virus. It sits within the DNA of a woman's cervical cells, and it switches off and on genes that make those cells precancerous. So it's a bit like a viral code in a computer program. It just corrupts things. Yeah. And so as a result, you can have cells that are within the cervix that initially become precancerous, and if left for a period of time, can become cancerous completely. Yeah. And of course, we've seen a massive reduction in terms of cervical cancer just purely on the basis that we're screening now for cervical cancer. So when we pick up these cells, and then often women will need to have something called a colposcopy, which is a microscope to look at the cervix. And then dependent on that, we then make a decision about how we need to treat that. And so in some cases, it might be just burning the surface of the cervix. Or if you imagine the cervix is a little bit like a skivvy, we actually have to take a larger portion of a skivvy. And if you think about the uterus as like a balloon, and the neck of the balloon where you blow the balloon up, that is the cervix. Yeah. Now you can imagine if you've got a long neck of the balloon and you put a knot on it, then the air of the balloon's unlikely to come out. However, now if that neck of the balloon's been cut, that's like doing a cone biopsy, then it's hard to put a knot in it. Yeah. And so the air of the balloon potentially can come out. So one of the concerns that we have as fertility specialists or obstetricians in my case is when a woman's had a cone biopsy that she's at a higher chance of something called preterm birth. And we put that at around 2.7 times the risk. So generally speaking, that the average pregnancy will go beyond 37 weeks. 5% of women will go before that. So 2.7 times is significantly higher. So that would have been the major concern for yourself, and I suppose those people looking after you during your pregnancy. Yeah,
and I think from my understanding from my OB, he had told me that it had travelled all the way up, and it was to a point where they had to take out a bit more than they thought. So he sort of drew it like a pie, and he sort of showed me the amount that they had to take out. And he said, look, the stitch, we have, we feel that the stitch, we had to do a cervical stitch once I fell pregnant. But he said, we have, every reason to believe that this will work, but we don't know until we know, And so the second trimester, once the baby was a bit heavier, was the part that was the scariest.
Anxiety for And so often, yes, you're right, during pregnancy, if we're concerned about that cervix shortening, we'll often use some vaginal progesterone. So that's to keep the cervix long and closed. But in addition to that, we also put in a stitch. It's a bit like putting a string around a balloon so that we can hold the air in.
Like a safety net.
Safety net so that the pregnancy can continue. And in vast majority of cases, that works relatively well. And we continue to monitor the pregnancy. So so obviously there was a lot of anxiety then from your perspective becoming pregnant.
Yeah, so it all it all sort of kicked off. I'm quite good with all my testing. I wouldn't call myself a hypochondriac, but I'm definitely on
when you need to.
Yeah, I'm really good like that. Like I take my health seriously. And it was actually my Botox lady that said to me, I was getting some Botox before my trip to go away, and she said to me, she used to be a GP and she moved into cosmetic medicine. Yep. And she said, oh, you're going on your honeymoon. That's really exciting. We just got married. And she said, oh, you think you're going to try? You're going to try for a baby? And I said, yeah, probably. Like, I think we're ready. Like, it's always, been together for 11 years at this point. So, like, why not? It's the next step. And she said, well, you should go and get everything tested. Just be sure. Go get your bloods checked. Go get, scans, what you need to get done. And then go on your honeymoon and, you'll feel good. And I said, no, that's fine. I got a pap smear only like 17, 18 months before that. So I was thinking I'm good. Like, I don't need to do that. I could do it when I get back. Like, I can worry about that later. And but the blood test I thought I should do. So I went and had that done. And the doctor actually said, just jump up. We'll do a pap smear while you're here, and we'll just, and I said, and I was sort of reluctant. Like, I was thinking about getting, like my nails done and my spray tan and packing my bags for my trip. I wasn't really thinking about that sort of stuff. And I just got it done. I just said, okay, fine, just do it. And then within, it was a short amount of time. I can't remember exactly, but it was quick. Like, between doing it and receiving the news that I had to go into to get a colposcopy, which is what you mentioned, which, to be honest with you, I know that every doctor is really well trained, but I found it a really traumatic process. One of the most traumatic things probably was the colposcopy for me. It was really, there was no numbing. It was, I don't think it's really spoken about much about how painful the biopsy actually is. So that was done. And very quickly they worked out that I had to go in to get
Were you by yourself when you had
I was by myself. And to be honest with you, I went in this is just like any other process kind of thing. I wasn't really mentally prepared for it. And then there was a lot of bleeding, and it really hurt a lot.
So I think maybe we should tell people about that, because it's important. So a colposcopy is like, well, we put a speculum in the vagina, much as what we do for cervical screening. And then we have a colposcope, which is that microscope that looks at the cervix. And we look for a particular area of cervical change. So sometimes what we utilise is something called acetic acid, which is effectively vinegar. And that changes the cells.
Brown liquid?
That's the next one that we do. So the first bit's the aceto white. What we do is we put on acetic acid vinegar, which makes the cells that are abnormal become really white. Yeah. And then we'll put the brown stuff, which is iodine, and that acetic white area stays pale. And so we know that that's potentially an area of where there is cervical dysplasia. 100% correct. It is, should I say it's barbaric? I don't do them now, but we do use a biopsy forceps. It's like taking a small sample from the cervix.
It's like a crunch. It's like a
little bite of the cervix, and in order to send that particular bound of tissue off to the pathologist to see whether there is indeed cervical changes. Some women will cope with the procedure very, very well. I mean, I do a lot of...
I've had 2 or 3 and the other 2 were fine.
Yeah. So
I think it depends doctor to doctor.
And maybe doctor to doctor. May also be just the way that, the doctor approaches it, yeah? Some doctors can be quite relaxing in the way that they approach things. And I suppose particularly if it was the first time for you, you would have been heightened, like, what the hell's going on? And I think part of it is all really understanding,
And I think, to be fair, the doctor... I had changed doctors after that point, but that doctor, I think she was quite scared with what she was saying, and I think she was even a little bit, I wouldn't say flustered, but she wanted to get it done. I had prepped her on the fact that I was heading away overseas really quickly, and I think in her defense, she just wanted to get the result, and anyway, so that was done, and then my results came back, and then I was referred to an oncologist. And she checked everything, and she said to me, look, I'm quite certain that it's not cancer, but we won't know until we actually go in and get you under and actually examine the cervix.
Would have been so frightening for you. You're thinking, I'm going on my honeymoon. I just got married, and you've been dealt with.
Have you put delays on the honeymoon at this point?
So at this point, I was like, cancel the honeymoon. Like this is more important. And they had actually all the doctors. Surprisingly, I thought they would take the clinical approach and say that's not important, but they actually said, look, we feel pretty good about the fact it's only a 3-week holiday. You wouldn't have found out about this unless you jumped up and got the pap smear, right?
Correct.
So go on your honeymoon and have that fun, enjoy it. You know,
as much as
thanks. I think I had a bit of a panic attack in Paris. I was sort of walking through because I was trying to like pretend it wasn't happening, and then it sort of kept coming up.
Yeah.
So I sort of went through my honeymoon just thinking, everything's gonna be fine. Like, it's gonna be fine. But the moment I got back, I was straight into surgery and then had it removed. So, and by that point, I was in the care of another doctor who was just like, I'm absolutely obsessed with him, and he was amazing.
Let's give it a shout out.
I don't want to do a shout out.
Yeah,
why not?
Why not?
Dr. Clement, Dr. Len
Yeah.
Clement.
Yeah.
He's just like a warm hug.
Yeah.
You know?
Yeah.
He's like a teddy bear, isn't he?
He
I've worked
is.
with Len. He's
Like
like
I almost want to go in for like fake checkups just to hang out with him. Like I think about, I should go get that checked.
he used to deliver a lot of babies, but he doesn't do babies anymore.
No.
He just does all the cervical stuff.
I tried to like use my negotiating skills to try and like wean him back.
One
Like,
day,
I was like, but I still see him for gynecological things, but I do love him a lot. Yeah. And I think you build a very special bond, with your carers when you're going through a hellish time. So anyway, so that happened. And then at this point, they had said to me, you're not allowed to really fall pregnant now, like for at least 6 months, because the cervix was soft, I think. Is that the correct terminology?
Well, it needs to heal, doesn't it?
Needs to heal, So they said you can't fall pregnant for that period. And so we that was fine. At that point, I didn't feel that to be honest with you, I was still trying to get over everything. So I wasn't really in the mindset of get pregnant. And then I think it hit 6 months, and I said to my husband, okay, now I think we should turn this ugly story into something really amazing. Let's try and fall pregnant and let's do this for us. Yeah. And so we started trying, and it was like, boom. Like, I think it was first time. He was a bit disappointed we didn't get to try for a bit longer, to be honest.
I think most blokes are.
He was like, really? Are you sure? I'm like, you're supposed to be really happy about this. But it was quick.
And so what did Len tell you about what you needed to do in that first instance in terms of pregnancy?
So it was very well planned out. So luckily I had already engaged with him before that point. So we were already well prepped in the notion of like what will be the plan. Len has an excellent bedside manner where he'll tell you everything you need to know. He's kind of like a need to know basis. Yeah. If you ask, you will receive. But if you don't ask, he'll give you just what you need to hear. And I think that was exactly what I needed at the time. I didn't want the over information because I truly trusted him. I really I really trusted his care. And so I just wanted to know, I wanted to enjoy the pregnancy and not be, a pregnancy that was just riddled with medical stuff. And just, I wanted to try and build a happy bubble around it, and he was really good at just giving me the right information. So it was 13 weeks I went in for surgery. So he sort of prepped me I went in at 6 weeks pregnant, I think. Yeah. And then he said, just prepare yourself at 13, we're going in for surgery. Yeah.
So, in terms of that, so just to rephrase what I said earlier before, so the cone biopsy is a large chunk of the cervix. Some women may have what's termed a Let's procedure for cervical dysplasia or precancerous cells, which is where we just take a smaller sample of the cervix. In some cases, we do cervical surveillance, which basically means from around about 12 to 13 weeks, we scan the cervix every 2 weeks to determine the cervical length, the length of the cervix. And we want this length of the cervix, generally speaking, to be about 25 millimetres or more. Yeah. And we'll keep going with progesterone, monitor the cervix. And if we see that cervix drop, then we'll put in a stitch. That's called effectively an elective or a clearly indicated cervical cerclage. Yeah. In your case, because Len knew that there was a lot of cervix already gone, that the suggestion potentially was, let's just put a stitch in. We don't have an option here. We don't have an option here. One of the other options that we can sometimes consider is something called an abdominal cerclage. This is where we actually put a cervix from above.
I've never heard
and
of this.
What we can do with that is, it's a little bit different because obviously the one that you had was done vaginally. You can actually put them from above, and
we need a uterus so you can show where it sits.
Yeah, we do need a uterus, but basically it's coming in from above, so we can get actually quite high up on the cervix.
Okay.
Now that stitch stays in forever. And so women who have that cervix, that's cervical sarclageal stitch, need to have a caesarean section. You can't have a vaginal birth if you end up having that type of stitch. But often that's indicated, and I've certainly done it for women where the cervix is really, really, really short. Like
that's interesting.
I was going to say, in cases that that it's shortened each pregnancy.
Correct.
You automatically
and particularly where we've put in a vaginal sarclage or a vaginal stitch, and unfortunately the woman's gone into labour or gone and had a baby earlier. Okay. So often we can talk about having an abdominal sarclage. And again, that success rate's really high, like we're talking in around 90-95%.
I wonder why that wasn't just, maybe in my particular situation it just wasn't an option. I'm not
well, it may have also been that you had enough of a cervix to put in a stitch, and that Len wasn't overly concerned about it.
That's
but as I said, it does commit a woman to having a caesarean section. With some women were like, no, I don't want to have a Cs. I'd prefer to have a vaginal birth.
Yeah, I didn't have an option in that matter. I think he said to me that if I ever chose to have vaginal birth, that would be probably the last child I'd ever have, because
the cervix would
be destroyed. Not destroyed, but I think you may have said
so that. Often, the anxiety about having a cervical sarclage and whether it will hold and whether it will be there in the long term is more than just doing an abdominal sarclage, because we do that preemptively before you're pregnant. You don't have to have it when you are pregnant.
Yeah,
and
that thought process, it's always
correct.
there. It's through the entire pregnancy. Every time you feel a twinge, or you think, oh, did I walk a little bit too far? And you kind of go into this blame game.
How did you feel when you had the 13-week? How did you feel when you had the procedure?
Yeah, it was pretty good actually. I didn't find it too painful, and it just sort of felt like a light period. Like it didn't.
Yeah.
And emotionally, how did you feel?
Emotionally, I think I was so excited to be pregnant, to be honest with you. I was so grateful, because I've had a lot of friends that have struggled with fertility. And so I was really, whilst my story is not ideal, I was really grateful for the fact that at least that little box was easy to check. I didn't take that for granted. So I think for me, even though I had all these things, I was still really happy to be pregnant.
And for us as obstetricians, it is a relatively easy procedure. I mean, a lot of what we do as medical practitioners, we do it so regularly, right? For the person who we're doing it to, it's the first time. So, having someone like Len who's very calm.
So calm.
He's got that elderly statesman sort of perspective. It very means that you were really reassured. Often when I do these sort of sarclages, we joke and we put music on, and I sing a few songs.
Yeah, okay.
I always hold my patient's hand as they're getting this. Did you have it awake or did you have it asleep?
No, I was asleep.
Yeah, so sometimes we keep the woman awake so she can have it with a spinal anaesthetic and be awake and
asleep.
You prefer to be asleep. And that's a choice. I mean, some women are happy to stay awake and some women go to have a sleep. So, but you can do it whilst you're awake. So, all right. So 13 weeks went by, but there was still all these anxieties that happened over the course of the pregnancy. How did the pregnancy go?
So the pregnancy was quite good. So the pregnancy, I didn't have any morning sickness. I didn't have, the only thing I had was like a little bit of hip pain. Yeah. But other than that, a bit of heartburn, but I always have heartburn. That's just part of my Gaviscon. I don't know if Gaviscon's a sponsor, but maybe they should be. But Gaviscon dual action should definitely. I've actually spoken to a lot of my friends that have fallen pregnant. I was like, that's the one thing. It should be in the bag that you give as a gift when you find out someone's pregnant.
We should have it at the front.
Yeah.
How did you do a gender reveal?
No, I'm not really a gender reveal kind of gal.
You weren't a gender reveal.
Did you know what you were having?
Yes.
You did?
Yeah.
When did you settle on the name?
So my late grandma, she loved Sophia Loren.
Oh, yes.
So
we're bringing Italian themes into this podcast all the time. So now it's Sophia Loren. She's Italian.
She's so beautiful. Yeah, So she always spoke about her, and I don't know, I just like the name. Like, I just think it's a really nice name.
It's also a good Greek name. We actually, Vanessa and I have a patient that we care for, because Vanessa's the doula and I look after the patients from a pregnancy perspective, and Vanessa looks after mental well-being and from a doula perspective.
Yeah.
And we had a Greek couple who broke their plate. Like, they've gone viral.
Oh my God.
They did.
Yeah, they've gone viral on TikTok.
Yes.
And they broke the plates.
And
so
the bottom
eventually
one
they got
had the
the-
gender.
And then
that's
the bottom one had the
cute.
gender.
Yeah, I like
Yeah.
that. Yeah, we're not really like, we haven't done the breaking of the plate. I've been to one wedding where they did that, but no, we didn't. Yeah, I
It
think
went nuts, and I was
So
that's
Sophia was
cute.
pretty much decided straight away. You knew it was Sophia?
Yeah, I'm very much like that. Like I make
Yeah.
decisions
Once you know.
really.
Yeah, I can tell that.
Yeah, I just
Yeah,
like,
yeah.
I just know what I
Type
like, sort of thing, and
personality.
Nick just goes along with it.
So-
No, he liked it too, but yeah.
So tell me what were you on any bed rest during pregnancy? What happened?
Yeah, so it was because it was COVID. Like I think just to paint a picture. So this is 2020.
Yeah.
So
Dan
the
Andrews
time
was on the. He's
Yeah.
telling us don't speak to your neighbour.
Yeah, it's funny. I look back on videos of when I was pregnant, and I'd scan it around the room and like, oh, look at this cute little dress. In the background, it's always Dan Andrews' voice
Yeah, oh my God.
because I always
Yeah,
had the
yeah.
TV on telling me
I
like
get nightmares when I
updates.
see
It's
that.
Oh,
kind of like
just-
it gives me PTSD. But anyway,
Yeah.
but yeah, I guess the timeline was that I fell pregnant, and then I announced my pregnancy on the 13th of March, and I think that COVID hit
19th or something. Or
like
something
days
Yeah.
later.
Yeah.
So it was like, hi, I'm pregnant. Oh no, it's lockdown. And then it was, now you're on bed rest. I was like, well, we're all on bed rest.
2020.
So we were all kind of on bed. Everyone was like living bed rest with me
Yeah.
in a way. So I didn't know that. I mean, now if I was to ever have another one, it would be different because it would be like the social.
Yeah, you'd lose that social norm, and also you
Yeah.
wouldn't be able to play with. I mean, look, this is not a medical consult, but
Yeah.
probably I would suggest investigating the possibility of an abdominal cerclage.
Yes, I will now.
because
Yep,
I think
never even
it'll
heard of
give you
this.
it'll give you a little bit more reassurance. In actual fact, the evidence for bed rest is very poor.
Yeah.
To be honest.
Yeah.
The 3 hospitals in Melbourne, the Mercy, the Royal Women's, and also Monash, did a study where they investigated whether you do a stitch and you bed rest or whether you bed rest and you don't. And,
wow.
And the evidence was basically that bed rest is not necessary. The problem is, when you're sitting there faced with a situation where the cervix is shortening and you're worried, is that study applicable to your patient? And so this is where we start going, well, maybe we should just bed rest. And so often many, particularly in the private sector, will suggest bed rest.
Yeah, and that was pretty quickly suggested, to be fair. And I think I was always trying to find like ways of understanding like how far I could push it, and I would say things like, okay, so if I'm at Lamana, like, how many laps of Lamana can I do? And Len would be like, just relax, okay?
Yeah.
Like,
I would have asked how many cannolis can I buy?
Yeah.
That's what
I'd say if I was a chatty, like if I park near Maya, like how far can I walk?
Yes.
And then he'd just be like, I think because I was doing that, he was probably like, this chick needs to go on bed rest.
Yeah,
we
you
need to lock
sit.
her up.
Lock her
Yeah.
down.
Yeah, lock her
You're in lockdown.
You're in lockdown, Janet. Yeah. So he put me in lockdown. But yeah, and then, we have stairs in our house, so he was sort of giving me like a plan. Like he'd say, like don't be doing like the Stairmaster like all day and things like that.
It is hard. I mean,
Yeah.
look, I've obviously had a fair share of my patients who've had cervical issues and putting in stitches, and the patients are sort of like, come on, can't I do stuff? Please, can I do stuff? Yeah. And there's this, you do have to have a bit of a negotiation. When did Len say, look, I'm happy for you to get up and start moving?
Probably at the 3rd trimester.
Yeah.
So I think
28 to 30
I think
weeks,
because I was getting internal ultrasounds really regularly to the point where that sonographer and I really got to know each other. He was
got bonded.
I don't know if anyone knows what an internal ultrasound looks like, but it's
Was it?
Do you want to
Andrew. I was about to
Andrew?
say
I think he just retired.
He did. He retired on Thursday. Went to his
did.
retirement.
Yeah, he actually forgot me. I went in for a checkup recently for something else, and
He forgot you.
Yeah, it really
good.
I was really affected by it. So he actually, I walked in.
You're like,
Good job.
sorry.
I was like, I do not
yourself.
remember him.
Yeah.
And he did all this. I remember you. But he,
I remember your cervix.
yeah, I remember your cervix. But I walked in and he's like, nice to meet you. And I'm like, Andrew, because I was literally in there like every 2
All the
weeks
time.
or even before, more than that. So, it was sort of, I got very used to it at that point, but it was really important that we were checking. Yeah.
Absolutely.
How did you feel when you're going for scans like that all the time?
The first time I was very nervous.
Yeah.
But honestly, the more you do things, it's like riding a bike. It was just like, it was very.
And then you become like a professional yourself. You look at the ultrasound. You're like, oh yeah,
I can
that's
see
okay.
the
It's all good.
thickness of this. And
So you
The
start,
stitches holding. I like it.
start to
you
read
can.
it yourself.
Yeah.
So obviously
definitely.
28 weeks, 30 weeks comes, you're given a bit of freedom.
Yes.
You're able to do your walk around the block just as long as you're not socialising with anyone back in COVID days.
Yeah.
Libra comes in a range of pads from a liner with double 2-in-1, invisible, ultra thin, maternity, and extra protect.
My number one tip for your hospital bag is Libra maternity pads.
How did navigating getting up towards birth then happen? Because you obviously Len had suggested a cesarean, I presume. How did that all go?
So I always knew it was cesarean. So I never imagined myself. I never had to work through mentally the idea that I wasn't going to have this, natural birth. I don't want to like to say that, but everything is I think is you shouldn't.
We just call it. We do.
I call it out the sunroof, but
I think we've got vaginal birth.
Okay,
we've got a planned cesarean section, and we've got an unplanned cesarean.
Okay,
section.
planned cesarean
and an assisted vaginal birth.
Doula.
It's a woke thing.
No, but you know what? Like I'm not super woke as a person.
Yeah.
However, I do think in this scenario, using the correct terminology to make people feel
the worst thing is in this whole birth space is women against women. It's not obstetricians against midwives and doulas.
No.
It's women against women. You had a cesarean section. You're too posh to push. I mean, are you for real?
Posh to push.
Or you took they say you took the easy way.
Honey, it's not the easy way.
Yes.
So the sunroof, it's somewhat jokingly, but it is diminishing the fact that you housed this baby, nurtured this baby for 9 months,
100%,
and you still gave birth to the baby. And just how that birth happened. I mean, I have my mantra is every birthing experience is unique.
Yes.
And no woman should be judged for the birthing experience she has. And so, often women will judge women. It's terrible.
Yeah, it's really strange. I always wonder how people have the time, capacity, and just mentality to be like that. Like, absolutely. I just think it's such an amazing thing, like regardless of however the baby comes out, if it's through the sunroof or if it's not.
100%.
I think the fact that you're growing little organs and you're watching yourself every day with what you're doing just to protect this little bundle of joy, and it's a huge job. And like however they come out, to me, it's one and the same.
The same.
Exactly.
And I'm so happy for people that get to have that experience, but I'm so happy with my experience, and it was amazing. So,
and one of the things that, partly one of the reasons why I see a lot of women who have had birth trauma, and one of the reasons why I've sort of started doing maternal assist Caesars, where women actually bring their babies out into the world, so they grab their babies and bring their babies out, is partly because I think there is this sense that there isn't a disassociation between having a vaginal birth as opposed to having a cesarean birth, and not being able to engage immediately with the baby.
Yeah, sure.
And so, gone are the days. For example, I was born via cesarean section. Gone are the days where the woman was asleep. And then all of a sudden they were presented with a baby.
Yeah, it happened to a friend of mine actually. She had twins, and last minute something changed, and they had to put her all the way under. And I think she's still dealing with the after effects of that.
Well, often there may have been some complications with the spinal anaesthetic, but generally speaking now, you're awake when you give birth to a cesarean, and in some cases you see the baby straight away, and you get to hold the baby straight away. But the maternal assist allows for you to actually have the baby, hold the baby, stay with the baby the whole time through the cesarean section. So it's quite an engaging experience, and it's removed that, some obstetricians
because there's like a little
they have a drape.
There's like a curtain.
Or you have a clear drape.
Or I have a clear drape, so you can see the baby's sun rising.
Wow, I like the clear drape idea. Yeah, because it was kind of like little curtain sort of thing.
Yeah.
And sort of just all I could see,
and then
all I could see was Len's nose, and then but even just seeing his face, I think people that don't know him, he's a very comforting.
You can see
man.
them smile under their mask.
He's like his little
You can see. You can see.
With his well, back then, so it was COVID. Yeah. So this is so when I gave birth, it was August 2020. Yeah. So I announced pregnancy pretty much the week that COVID hit, and I gave birth when it was the moon man suits, when everybody was really paranoid. You can hear them walking. You'd see people in their cars driving alone with masks on, what the hell? Crazy. But that's the world that we were living in. It was
How did you feel that day driving in, knowing that everyone, no one would have been on the roads then?
It was really, there was no one on the roads. You're right. So when we arrived, there was a bit of a drama. So going back just a little bit into I had a planned cesarean that turned into an emergency.
Right.
Okay.
So how many weeks were you?
So I was 35 weeks.
Okay, so you did go to labour early.
Yeah.
So what happened specifically?
So she had stopped growing. So we did the internal ultrasound, and she had been progressively growing, and I think she went from 2.2 to 2. And then by the time she came out, she was 1.65. Yeah. So she was a tiny little baby. But my placenta failed. So that was just something completely unrelated to the cervical situation. And they took it away for testing once I gave birth, the placenta, but we don't know exactly why that happened.
So it was just
I remember Len pulling out the placenta, and then he said, "That's a funny little placenta." And he's like, "Did you want to have a look at it?" And I'm like, "No, I'm right."
You can have it.
You can take that away. Show me the baby.
It is one of the things about, going privately for your obstetric, and there'll be a lot of people here who are listening to it that go public or private. And there's not, you choose you, but one of the things that we do in private is we scan regularly, even for a woman who's not having issues with her cervix. I'll scan at every visit and look at the size of the baby. And if I'm worried about the size of the baby, we'll increase our vigilance in terms of surveillance. And one of the things I would say to people who are having their baby in the public sector is, if you're worried about the baby, spend the money, go get an ultrasound scan done, because the public sector is great for cookie cutter obstetrics or pregnancy care, right? It's not specialised, and that's partly one of the reasons why you pay so much to go privately, is for that extended care. But in saying that, if you are worried and you're in the public sector, go and get a proper ultrasound 100%. Scan if you're worried. In fact, I'd say to every woman out there, or any person who's pregnant, go and get a scan about 32 to 36 weeks and have a look at the growth of your baby.
It blows my mind, because I was so regular and I had no choice, that there are women that have to go that length of period without knowing.
They don't see.
I can't even imagine. Yeah. And I understand that is just the scenario that is playing out for them, and that's just. And some women are fine. Like my mum had magic pregnancies.
Correct.
Where she was doing all this. She was walking and she was cooking and she was cleaning, and she was just like pregnant and then had a baby. Nobody think about it.
I agree.
It's not always like that, though.
Well, it's not always like that. And a lot of people go, "Oh, I don't need it because I'm going to have a fine birth. I'll have a home birth. I'll be fine." But the reality is, a lot of what we do in our lives is all about insuring or mitigating against risk. So we'll take out car insurance. Why? Because we think we're going to have a car accident? No, we don't want to have a car accident.
Yeah.
But we take out that insurance because in the unlikely event we do, we're insured. Same with house and contents. And it's the same sort of thing in this scenario. Yeah, sure, 99.99% of the time everything's going to be fine.
Yeah.
But just to give you that sense of reassurance, I think it's, particularly if you're worried, you definitely should do it.
I don't believe in my heart of hearts that this would have been picked up.
No.
So at that point, it was
particularly during COVID,
because we were booked in.
Yeah.
We were booked in, ready to go. Yeah. Like we were getting that baby out on the date. I had my bag packed. I had nothing ready because it was, this is the date you're going in. Now, it was Len's diligence and him making that decision. Yeah. And to be fair, he actually pushed back on me, because I remember I said to him, I was a really small baby. Like I was born at 2.2 and my mum had dream pregnancies. And he's like, respectfully, I don't care.
Yeah.
Respectfully, I don't actually care.
This is you.
I'm not talking about your mum. I'm talking about you, and this is what's happening. And you need to go. And he said, you need to go get a COVID test because you're getting the baby out tomorrow, or the baby's coming out tomorrow.
So what was it? Bubba comes out into the world. So you ended up going in a little bit earlier.
Yeah.
How did the Caesar go?
So it was good. They did lose not Len, but the system lost my husband's COVID test. There was a moment where I had my spinal tap. Is that what it's called? What's the spinal block? Whatever. Yeah. And they couldn't find his, so they weren't sure if he was going to be able to come in. And I think that decision was overridden, and we were all on the masks. But the cesarean, from the moment, so there was drama. And then it became super calm. Yeah. And I just remember being in the best care and just seeing all these beautiful faces and I gave birth at the Epworth and they were just amazing. Yeah. And then from there on, it was almost like a dream. Like I just felt there were clouds and like birds chirping and then she came out and she was perfect. And,
And the rest is history. Well, not so much history, but lovely. But as we're now navigating the prospect, are we thinking about having another one?
Potentially, yeah. I think for me, I'm so happy with her that she's more than I ever bargained for and more than I ever asked for in a child. So for me, I said, like I've always been like, I'm not that person that continuously strives for perfection. I think
Yeah.
I'm just like, I feel really happy with our scenario.
Yeah.
But with that being said, it's not off the table.
Yeah.
It's
It took me and my wife the third one to get it right. I mean, the third incarnation, she's perfect. No,
I
was like, the third one always is.
I'm one of three. My mum got it right second time around. So.
I'm one of three. She got it right.
So I don't know why she went for another one.
You know what? You never regret having another one. You just regret if you don't have another one.
Yeah, totally. And I always say, like, we will definitely, like, it's not off the table.
Yeah.
But
do you go into this next pregnancy with a sense of a bit more calm then if you were to become pregnant?
I'll let you know. I feel like I'm kind of like I was none the wiser last time, whereas this time I'm well informed.
Of course.
So is that a good thing or a bad thing? I'm not really sure. Like I think knowing too much sometimes can be.
Yeah, but now you know to ask the question.
Ask the questions.
Yeah, the questions that you'll know when to ask.
Yeah, totally.
And, and you had a great team, and it's about finding that team again.
I think if you've got a good team around you, I think especially if you're going through some stuff, that is the best money that you will ever spend in your entire life. And if you're going to go buy sneakers and you're going to go spend money at nice dinners and things like that, like this, I would rather not do anything else in my life than spend money on that scenario just to get it right.
Yeah.
So it was, a really good experience.
You have to let us know how you go, and if you do have another bubba, you can come on and tell your story.
Yeah, absolutely.
Well, thank you so much. You're the first guest that has come on and shared their journey with us. So we really appreciate it.
No,
so thank you so much.
Thank you for having me. I appreciate it. Thanks, guys.
Thanks.
Doula and the Doc, hosted by Vanessa Salerno at birth.
Can we just put in the bloopers at the end?